You know, how did you detect this? Because I've been reading the papers and I've been reading a lot of other digital articles. Apparently, you are the doctor who actually detected it this time around. Is that right?
2018, we have detected the Nipah
Yeah.
virus outbreak for the first time. This time, it was actually a teamwork in Aster MIMS Hospital, Calicut. Initially, we got four patients, three children and one adult patient. They got admitted under pediatrics department and pulmonology department. So after taking a detailed history, the clinicians came to know that one death has occurred almost 2 weeks back in that family, and he died because of severe pneumonia and later developing multi-organ failure. And the exact etiology was not identified at that point of time. So now these patients were admitted with mainly respiratory symptoms. And when probing into detailed history, they came to know that they are near from the previous epicenter from where the Nipah was reported last time. So on discussing with the previous doctor who was treating that patient who died, and again taking other the details from them, the team came to know that there were some unusual features, like the initial patient, along with the respiratory symptoms, also had a slurring of speech, diplopia,
Okay.
etc. So at that point of time, we created a multidisciplinary team to discuss and find out what may be the cause. So at the same time, the child, one of the children admitted, developed seizures. So putting all these points together, an index patient, then a cluster forming after 2 weeks.
All right.
The cases are from near from the epicenter, and there are some unusual features. So putting all these together, the team felt that there is some unusual viral infection happening, and it can be Nipah as well. That is why we have decided to send the sample. At the same time, we received one more patient from
Right.
a local hospital with viral pneumonia.
Huh.
And later we were able to establish the contact with the probable index case. That is why, immediately after reaching our emergency department, he developed a cardiac arrest, and we couldn't revive him.
Right.
So, as we were having a suspicion, we didn't hand over the body, and we have followed all
All right.
Nipah protocol in handling that dead body as well.
All right. I mean,
Then
that's
next
really,
day,
yeah, I think that's brilliant. You know, the start seems to be at least very positive and very, very proactive. I must say, Dr. Anoop Kumar, let me come back to you. Let me now say hello to Dr. Rajeev Jayadevan. Rajeev, do you think that now, I don't want to sound like the prophet of doom, but do you think that Kerala will now have a Nipah virus, periodically? And I am asking you this because this is the 4th episode. Please correct me if I am wrong. And this time around, they say it's a Bangladesh variant, which goes, spreads from human being to human being, not from animals like it was being said earlier. And although it is less infectious, there is a high mortality rate. So, it seems to be mutating or changing avatars. So, do you think Kerala needs to be ready, or we can't come to that conclusion as yet, doctor?
At this time, since there have been 4 outbreaks, it's quite likely that there will be other outbreaks in the future. For instance, in Bangladesh, outbreaks of Nipah are quite common. And experts from all around the world have flown down to Bangladesh. They've camped there, they've caught the bats, they have looked at how these diseases are spread in the community. But unfortunately, there is no definite mechanism identified on exactly how this virus that lives peacefully in the bats jumps onto man and creates such a lethal disease. If you look at the published papers from Bangladesh, from our own country, in West Bengal, none of them have produced a conclusive evidence. But that being said, even COVID, nobody still knows how the virus got to man. So it is not a total surprise, but it will be important to crack that part of the case specifically in order to address your first question: is Kerala going to have more outbreaks? if we can identify a specific mechanism that increases the risk of this jump, yes, we have won. Otherwise, we will always be chasing after a moving target. So that's step number one. The second thing is that these viruses are generally of two categories. One is mainly in the Bangladesh area and the bordering state in India, that's West Bengal. They have identified a particular type of clinical cases. And then there is a Malaysian type, which is slightly different. It seems to have used pigs as an intermediary host. But the Bangladeshi type of Nipah, if you can call it that, and the one seen in Kerala have similar clinical manifestations in the sense that there is no apparent intermediary host. So there's a lot to be learned still.
Right. Dr. Anoop Kumar, I want to ask you that, there were a bunch of doctors, you were there was a team which was working, and also you have the 2018 experience. I will ask you as a layperson, in Delhi, dengue has spread like anything, particularly school-going children are now showing symptoms. We, all of us across the world, have lived through COVID, right? How do you differentiate, doctor? You go to a doctor like Nipah, is there anything specific which should tell someone that it could be Nipah and it is not, let's say, encephalitis, or it is not, any other fever, as it were? Are there any indications, Dr. Anoop, like that?
Yes, obviously. One thing is, like, as I've already told, there will be clustering in case of Nipah. Then another, there are some particular clinical features. One thing, the patients will be having encephalitis-like symptoms along with the respiratory symptoms. And in encephalitis symptoms also, there are some peculiar findings which we can pick up, like there may be segmental myoclonus, segmental sweating, the brainstem signs like the pupillary sizes will be, asymmetry will be there in the pupillary sizes. And sometimes there may be, the patients will be having a sympathetic surge response, means patient will be hypertensive, then they will be having too much tachycardia. So all these unusual features along with the clustering can definitely lead on to the suspicion of Nipah virus.
And also now we see that 950 people are on the list and the government is trying to trace them, trace their path, as it were. Where did he go? Who was he with? Because health workers have also been, now they are also on the high risk list. I want to ask you something, doctor. It's very highly contagious, isn't it, Dr. Anoop, this Nipah?
Yeah, it's like the initial case, the infectivity will be more. So majority of the cases, the transmission will be from the index case. As the cases progresses, in subsequent cases, the transmission chances will be less. So we usually express these transmission chances in terms of R0 value. You might have heard during COVID as well. So the R0 value of this Nipah will be somewhere around 0.2 to 0.3. So as the cases progresses from one person to another, the infectivity will come down and it will settle by its own. That is the usual pattern of Nipah virus.
Right. Rajeev, no vaccine for Nipah as yet. Am I right or am I wrong?
No vaccine yet.
Yes.
So let me break down what Dr. Anoop Kumar said for you. He said the R0 factor. Basically, in plain English, it means if 10 people get Nipah, and they will only be able to pass it to 3 people if the R factor is 0.3, and those 3 people will only be able to send it to give it to 1 person, and so eventually the transmission chain just dies off. That is what he meant by saying it's self-limited. So if you see historically, all Nipah outbreaks have been self-limiting, but that does not mean that you should not do contact tracing. You must try your best to see if there are contacts, if there are people who are potentially infected, and isolate them and treat them to the extent possible.
And it is curable, because there is paranoia post-COVID across the world, with these, of course, there are very less deaths, and I hope there are no more deaths in Kerala. But the point is, there are people, the infections, the active cases have gone up. But Nipah is curable, isn't it? Does the same rule apply that like for COVID, like if you present yourself with comorbidities, your chances go low, age is a factor, etc., etc., or you think that it doesn't work in Nipah that way, Rajeev Jayadevan?
I'll let Dr. Anoop Kumar answer that because he is actively treating these patients. But overall, I'll tell you, Nipah is not curable. It has a high mortality rate ranging from 70 to 91%. In fact, the most recent outbreak in Bangladesh, which happened to be bigger than usual in January 2023, resulted in a very high mortality of approximately 10 out of 11 people died. So it is not curable in that sense. It's preventable to a large extent by contact tracing, but you really do not have a means of curing it. But that being said, you can provide good supportive care to patients. For instance, if there's someone with brain swelling, there are medicines that can bring down brain swelling and also cut the number of seizures down. I'll request Dr. Anoop Kumar to elaborate on the treatment modalities.
Dr. Anoop Kumar, does that mean, I'm so sorry, but I'm scared, does that mean that if I get Nipah or someone else, it's difficult for us to survive?
No, we can't say like that because right now we have 4 active cases.
Thank
2 cases
God.
are under our care.
God.
So in that, the 2 patients are absolutely stable. They had only mild fever and cough. Now those 2 patients are getting better. One, a child, he's on ventilator. Again, his vitals are also stable for the time being, even though he's having the features of brain dysfunction. The other patient is also having the features of encephalitis, the brain infection, but that patient is also doing well. So what Dr. Rajeev is told, it is correct. Like the previous outbreaks, the mortality rate was somewhere between 40 to 80. The previous outbreaks in Kerala, that is 2018 outbreak, the mortality was somewhere around 90%. But this time the severity seems to be less. So I think we will be able to cure the disease. At least the mortality will be below 50%. That is what we expect now.
Great. That is fantastic news, Dr. Anoop Kumar. Rajeev Jayadevan, I want to ask you, for many people, I had done a lot of stories on Nipah, the scare of Nipah post 2018, and there were a lot of reports in newspapers that people were now very scared to pass under huge big trees during morning walks. I don't know if you recall that in Kerala, whether it was Tirunelveli, Kottayam, everywhere, they said we are avoiding trees because I can see a bat sitting up there. I think the bats have become the most hated mammals, if I may say so, whether it's COVID or whether it is. Tell us, when Nipah,
yes, we saw
Nipah,
right.
When what is the difference? The last time around it was coming from bats to human beings. How does it spread from bats to human being, for God's sake?
Yes, as you know, every time an epidemic or a pandemic occurs, epidemic is a smaller version. Pandemic is all over the world. So any of these things, when they happen, or if a medical tragedy occurs to someone famous, there's all sorts of catastrophic theories that fly around on social media, and then this makes people quite jittery, and they come up with all sorts of conclusions. Walking under a tree is dangerous. No, it is not. People have been walking under the trees ever since man was born, and how many people have died of Nipah. So there's no need to fear in that sense. But what I would caution against are the following. Number one, stay away from bats. Don't handle them. Don't try to harm them. Don't try to get rid of a few of them in a knee-jerk reaction. That has happened before. Never approach bats because these animals can bite you. In fact, a bat can bite you 20, 25 times before you know it. So they're pretty aggressive animals when threatened, and so are squirrels, by the way, because I've been bitten once by a squirrel. So, but coming back to the bat issue. Second is, if you find a dead bat, just leave it alone. Don't try to experiment with it because they carry a lot of viruses that can easily jump to man, which may or may not cause disease. So stay away from that animal. That's number one. Number two is, if you ever see fruits lying on the ground under a fruit tree, including myself, we've all been tempted to pick it up and have a go at it because it's ripe fruit. Stay away from it. But that being said, there is no need to spread excessive fear about buying fruits from your market or from your friendly neighborhood fruit store or from your fruit vendor. As long as the fruit is clean, it doesn't seem to be bitten by anyone, by any animal. If there are no scars on it, just give it a good wash like we would anyway, because that's standard recommendation. So those are the 3 recommendations I have for the general public for Nipah. It does not spread across like COVID did. it is really not a disease that has pandemic potential.
Right. Dr. Anoop Kumar, tell me something, it's very intriguing. In this episode of Nipah, where do you think must it have, this must have come, because it's now being called the Bangladesh strain. So, is it proper to kind of say that it came from Bangladesh or not at all? It's the strain. I mean, where you, because you've been at it right from the first case which presented itself at your hospital, where do you think this Nipah came from this time around?
So we have the previous, the published data from 2018 by NIV team. So they have conducted an extensive bat survey at that time, and they've established the presence of Nipah virus in the bats. And as you've already told, that was also Bangladesh strain. So Bangladesh strain doesn't mean that we are getting it from the Bangladesh. So that means like the disease, the Nipah outbreak, when that has happened in Bangladesh, that was the similar strain. So as Dr. Rajeev was mentioning before, in the Malaysian strain, there is only the animal to human transmission, but in Bangladesh strain, there is man-to-man transmission. So when they analyzed the strain which was found in 2018, it was having almost 99% similarity to the Bangladesh strain. And coming to your question, the root source. So in that paper, they have checked the strain of the bat Nipah virus also from the same location, and it was also almost similar to the strain found in those patients. So the root source is definitely bats. There is no doubt about that. The question to be answered is, what is the mode of transmission from bats to human being? So that is not yet clear, whether it is the contaminated food, the fruits, or some contaminated secretions. That is still not clear. And I think it will be very difficult to find out as well, because majority of the time, like we are not getting the index case. By the time we are diagnosing from the second group of patients, the index case might have already dead. So it will be a bit difficult to find out what may be the exact mode of transmission. So there are like a few assumptions that has happened last time. In 2018, during multiple questioning from the relatives, friends and all, we came to know that the index case, he was handling an injured bat. Again, we don't have any video clippings or so to say that that has happened, but we are assuming that that may be the reason. And in 2019 outbreak, not 2019, 19 again, it was not very clear. In 2021 outbreak, he has consumed some fruit, again bitten by this, probably bitten by this bat. So those may be the two probable mechanisms: consuming the fruits contaminated by the bat secretions, or like directly handling the bats, or like going near to the bat's habitat. These may be the reasons.
Rajeev, I want to ask you that, how prepared is Kerala? Because I see Veena George really proactive there, because she has an example which was set by Shailaja teacher to follow, like I read in my introduction, the way it was handled. The thing is, what about beds, medicines, early care, then also critical care, all that? Is Kerala well equipped? Because like I said, all our paranoia is coming from COVID now. When there was a lack of oxygen, no beds in Delhi, we saw horrific cases. So I am asking you that how well prepared is Kerala?
Kerala is extremely well prepared for many reasons. One, the state has excellent health infrastructure, both in the private as well as the public sector, and the two sectors work seamlessly together. And we doctors in Kerala, it's ourselves, as far as I know, we tend to work together very well. Dr. Anoop Kumar and I have shared so many different meetings. We've shared our experience, knowledge, because we work in different domains, and so we complement each other. So there's a very nice network of healthcare professionals in Kerala. The infrastructure is excellent. The isolation facilities, which are specifically needed for such an outbreak, have already been set up. And in case some people deteriorate, they have kept ventilator facilities and intensive care facilities, not only in the main medical college in Calicut, but also in some really excellent private healthcare facilities as well as government facilities. So there is no dearth of infrastructure. And secondly, the state has already handled this epidemic more than twice. So people are aware of it, including healthcare personnel. But that being said, people need to be reminded every now and then about following protective equipment, like safe behavior around patients, for example. We still see people crowding into hospitals to visit family members who are down with fever. Hey, you know what? Hospital is not a place for social visit. And that message has to go down to the community, because God forbid, if that person is having a contagious disease, you're going to spread it to very large numbers of people in the community. And that message is to go out. The second point is that there's still a need for good, clear communication to the public, pretty much what we're doing now. One, please don't fear about buying fruits or drinking fruit juices as long as they're clean. The second thing is, as I said, do not go into knee-jerk reactions like let's kill a few bats. All that is not helpful. And today there was a man who was apprehended after posting a fake news claiming that Nipah was the creation of a pharma industry. See, this is the problem. We saw that during the pandemic when people,
yes, right.
When we got a lot of help from the pharma industry in terms of they produced vaccines that saved a lot of lives, but still the industry took a big hit. That is pretty uncalled for, and it's extremely unfair to target one industry in that fashion. So this person was apprehended. I'm glad he was today. It's today that this episode happened, and it should serve as a strong warning against people who post things that are completely wrong and out of their own fantasy on social media. And these messages get carried forward. Yesterday, I was trolled on Twitter by somebody else who claimed that Nipah was a pharma creation. So such strange and deviant behaviors must be discouraged as well.
Absolutely. Dr. Anoop, the patients whom you are treating right now for